All right. So welcome everyone. We're going to get started with today's webinar, which is on technology use and attitudes towards aging among older Canadians during COVID-19. New polling results. If you don't know me, my name is Darina Simyanov. I'm the Policy and Knowledge Mobilization Manager at AgeWell. I'm going to give those of you who may not know too much about AgeWell just a quick overview before we start. And so AgeWell's vision is that Canada's leadership in technology and aging benefits the world. And our mission is to develop a community of researchers, older adults, caregivers, partners, and future leaders. And really what our goal is to accelerate the delivery of technology-based solutions that make a meaningful difference in the lives of Canadians. And so what you see here is that AgeWell is truly a success story as Canada's technology and aging network. We have over 250 researchers across 43 universities and research centers in Canada, over 760 trainees or HQP, over I think 40 plus startups at this point that we support, 4 national innovation hubs, which I believe is soon to increase. One of our hubs is actually launching formally next week, so check out our events page for that. And 118 solutions so far coming out of the network. Most importantly, there are 4,700 engaged older adults and caregivers that participate in AgeWell, many of whom are on the call today. So before we get going with the presentation on these polling results, I'd like to have the folks that are with us here today introduce themselves, so we can just go right across the screen there, starting with Asan and then Judy and Andrew. So Asan, if you could introduce yourself. You're on mute.
Thank you for that. And thank you for the opportunity to share some of this research. My name is Asan Sadek. I'm the Director of Market Insights, specifically focusing in the health and wellness space at Environics Research, which is a Canadian organization, a Canadian research firm. We've been operating in Canada for close to 30 years with headquarters in Toronto and across Canada. And I'm really looking forward to sharing this, the results of our most recent research, which is a follow-up to what we did in 2019.
Great, thank you. Judy.
Well, thank you. It's my pleasure to be here with you today. My name is Judy Tinning. I'm a wife, and we have 2 sons, 4 grandchildren. I'm a retired history teacher with the Toronto Board of Education, where I taught for 30 years.
Thank you. And Andrew.
Hi, everybody. I'm Andrew Sixsmith. I'm a professor of gerontology at Simon Fraser University and Director of the Science and Technology for Aging Research at Simon Fraser University in British Columbia. But most importantly, I guess, is I'm Scientific Director of AgeWell. And, you know, AgeWell has commissioned this piece of research, and it's very, very timely. And I'm really keen to hear the presentation from Asan.
Great, thank you, Andrew. And so as we pull up Asan's slide deck here, we want to hear what your role is coming into this webinar. Are you a caregiver, older adult, maybe a part of an industry, community organization, or maybe a policymaker, researcher? Check one of those boxes out, and if you're other, please type in the chat box and we'll get a sense of who's on the call. I know there's lots of trainees that are on the call as well, so we're excited to have everyone join us. Great, and Taja, maybe you could just let us know what those results looked like, either in the chat or verbally.
Yep, it looks like we have the majority of researchers on the line and some are from organizations. So
Perfect. Great. Take it away, Asan.
Mute. All right. So we're here today to share the results of the most recent survey that we did. This is, really to discuss the attitudes of older Canadians towards technology, aging, and health in 2020. We did a similar work in 2019. A little bit of this work was obviously adjusted due to COVID, just to see the impact of COVID. But for the most part, it is a repetition of what we did in 2019 prior to COVID. So as I said earlier, just a little bit of background about us. We're a proud Canadian company that we've been doing research in Canada, informing public policy and health policy in a variety of areas. Just a little bit more detail about the survey itself. So as I mentioned, it was a follow-up to a 2019 survey. And it was conducted with 2,026 Canadians that were 50 years of age or older. The research was fielded in July 2020, so it's very timely and very recent. But I would say that the majority of what we're talking about today and most of the data points that I'll be sharing today focus on Canadians who are 65 years of age and older. So just keep that in mind as we go through the data. Overall, I'm going to go through some of the more specific data points as we go through some of the slides, but I just wanted to, point out what we specifically found from an overall level. So we basically found that COVID-19 has impacted older Canadians' attitudes towards aging. We see them being a little less optimistic towards aging in 2020 compared to 2019. And a portion of them also indicate that they are have been left feeling isolated due to the pandemic. The interesting part is that technology has played an important role over the past few months, and they are quite keen towards technology. And we've noticed that, use of technology has increased over the past year. Now, the use of technology, the increase in use of technology is partly due to COVID-19, but it's, based on all we know, technology use is increasing year over year, regardless of the pandemic or not. So what we find is that COVID-19 has just accelerated the use of technology with older Canadians using technology to keep in touch with others, for essential tasks, and also for entertainment purposes. Next slide. So just talking about aging as an attitude, we see that in 2019, 58% of Canadians were optimistic about aging. In 2020, that's dropped to 51%. So, and that is a significant drop at a statistical level based on our sample size. So we can say with confidence that Canadians 65 years of age and older are less optimistic about aging now than they were in 2019. What we also find, we specifically asked, is the impact of COVID-19 on various areas of their lives. So we did find that about 1 in 2, so about 50%, which would be your two, the red and the pink bar summed up in total, about 1 in 2 of Canadians 65 years of age or older are more concerned due to are more concerned about their health and wellness, about losing family and friends, moving to a nursing home, and moving to a retirement home. And this is a result of COVID-19. So definitely some challenges, expected in the future due to COVID-19. And as I mentioned earlier, 65% of the same people have felt isolated at least some of the time during COVID-19. So again, the impact of COVID-19 on their attitude towards aging is evident, and it has left them feeling isolated as well. But what has technology done, and how has technology helped during the pandemic? We'll dig a little bit into that right now. Generally speaking, we see that 88%, so the majority of Canadians 65 years of age or older, are using the internet daily. And that's kind of continued since 2019, where that was 86%. So slight increase, 86 to 88, but still vast majority of them are using the internet and are online on a daily basis. We also see increased smartphone ownership among that age group of Canadians. So in 2019, 58% of Canadians 65 years of age or older owned a smartphone. That's gone up to 65%. Again, that's a 7% increase, which may not look like a lot, but that is a significant increase at a mathematical level. So we can definitely make the conclusion that smartphone use has increased significantly over the past year. And the majority of them who own smartphones are using them daily. So 83% of them are using them daily. So really there is quite a lot of smartphone usage. We do see that 23% of them are using smartphones for video calling purposes. So, you could almost make the case that smartphone user or usage or ownership has increased, partly due to the fact that a lot of them are using it for video calling. And those who are using it for video calling, 6 in 10 of them report increased use due to COVID-19. That 23% of Canadians using smartphones for video calling is twice as many as we noticed in 2019. So you see the impact of COVID-19 there. Slightly fewer of them, 17% of them, are using video calls on a desktop or laptop. And again, about half of that is due to COVID-19. So again, COVID-19 really impacting the use of technology and how Canadians use them to stay in touch and not feel isolated. As we saw earlier, they have been left feeling a little bit isolated. Social media use has gone up as well, and we'll see exactly in the next slide or so exactly which platforms have received the most uptake. But generally, again, 37% of Canadians 65 years of age or older indicate that they use social media to communicate with family and friends. Again, a large portion of that is due to COVID-19. 23% use social media for health, wellness, or independence. Again, about half of that is due to COVID-19 as well. So what platforms have they started using compared to 2019? And again, some of these percentages seem low, but they are statistically quite significant. So for example, in 2019, 63% of Canadians 65 years of age or older were on Facebook. That's jumped to 68%. YouTube's gone up to 40% from 37%. Instagram use is 19% from 15%. Twitter is 18% from 16% in 2019. And WhatsApp being one of the more higher jumps, again, not surprising because we know that they would be using that for communication purposes. That's only really the dedicated communication platform. So a lot more social media use as a mode of communication with friends and family, as we saw earlier. Two in 10 Canadians, so 19%, are using online shopping for essential items. So things like groceries and so on, which is mostly due to COVID-19. So it goes to show that there are a portion of them that are comfortable with using these sorts of technologies and have adopted them, mainly due to COVID-19. My slide is having, there we go. From an entertainment point of view, 30% of Canadians 65 years of age and older are using streaming services. So whether that be Netflix, Amazon Prime, YouTube, and so on. And again, half of that is, increased use due to COVID-19, using it for entertainment purposes. In addition to some of the technologies that we just discussed, and these are a little bit lower in terms of usage, but 13% say that they use exercise or activity apps or trackers. That's partly as a result of COVID-19, but mostly that's kind of held, that's kind of stayed consistent since 2019. You won't suddenly use an exercise activity if you're using it before you're using it now. And the same thing with the voice assisted text. So not a very high usage there, 11%. And again, not very much so due to COVID-19, but we would not expect these things to have an increased use due to the pandemic. So status quo in terms of usage versus 2019. But again, speaks to the variety of technologies that this age group is comfortable with and willing to adopt, regardless of whether there's a pandemic or not. And as I was mentioning, so with all those various technologies that they use, 72% of them say that they feel at least somewhat confident using current technologies. So that's very high. And 55% say the pace of technological advancement is just right. So again, their openness to technology and their willingness to adopt is quite high. On the opposite spectrum, so what are some of the challenges? And we see that about 16% say that there's a lack of training on how to use technology, and about 9% experience poor connectivity. So from a thinking forward point of view, if there are technologies and somewhat complex technologies that the researchers or whoever are developing, including AgeWell, are supporting, the training aspect is something to consider, as is the poor connectivity for some people might be an issue. So just to keep that in mind when developing new technologies. But all that receptivity towards technology means that over half are willing to pay for out-of-pocket for technology that helps them manage their health and wellness. And even higher, 66%, are willing to pay for out-of-pocket for technology that allows them to stay at home as they age. So again, very high receptivity and comfort and acceptance of technology from that perspective, especially when they're willing to pay for it out of pocket. What has the impact of technology been on the lives of Canadians 65 years of age and older? Generally, when we look at it from a COVID perspective, we see that 50%, 49% say that technology has had a positive impact on their lives during COVID-19. And you look at the others, the gray part of the pie is neither positive or negative, 46%. So very little in terms of the negative impact, which is nice to see. So technology really helping them deal with the pandemic. And generally speaking as well, 65% say that the impact of technology is positive. And that's increased a little bit from 61% in 2019. So again, speaking to that acceptance of technology amongst this group. They also agree, over 6 in 10, or about 6 in 10, agree that technology, or technological advancements, can lessen the impact of COVID-19 on daily life. 64% agree with that. Technology can maintain relationships with family and friends. We saw that with the increased use of video calling on the smartphones. It can help reduce social isolation. Again, that's tied into maintaining relationships. It can also help them pursue hobbies and interests. It can help them stay safe, stay independent, manage their mental health, stay in their homes longer, which is tied back to the fact that they are willing to pay for technology that helps them stay in their homes. Generally help them manage their age better, manage their health better as they age, as well as stay active as they age. So that wraps up my portion of the presentation. I'll flip it back over to you, Dorina, and I'll also see if there's some Q&As that you'd like me to get to.
Great, thank you, Hassan. That was great. That was a great overview. So I'll bring all our panelists here to start to respond to some of that. And I see lots of a couple of questions at least that have come in already. So we'll get to those as well. But I wanted to start with Judy. I want to hear from you about how these results resonate. Do they resonate with you in your experience, and just what have been some of the positive things coming out of increased technology use for you during this time?
Oh, well, they absolutely do resonate with us, because it's given us the variety that we need during this time, now that our regular activities are finished. One of the things that I really appreciate is the ability of things like we do senior education, we play bridge, etc. How they've been able to pivot. So it's actually opened more doors now. Instead of taking one course, all of the courses are available. But we play bridge, we Zoom with the children, I Zoom with my book group and my bridge friends, my quilting friends. I have now reading things like the New York Times, The Morning, or The Point, things like that I probably would never have seen before. The newspaper has been a wonderful source of information. Webinars being offered by North York General Hospital, Sunnybrook Hospital. And as soon as you get into these things and you see the number of resources that they have available as well, the University of Toronto. So sometimes I almost have too much to do. But I certainly have had issues. If you want me to talk about that now. If it's clicking on an arrow, clicking on a link, that's fine.
Yeah.
But when it gets much more complicated than that, I'm really good at calling customer service or using the online chat. So some of it has been a little tricky, and I must admit, when it gets too tricky, I tend to back off and call the children, and they sort of sort me out. And I co-authored a blog with my daughter-in-law and her mom called Nanograms in the spring into the early summer. And getting documents, Google Documents, was a real challenge. But
Great, yeah.
Order groceries, I read through Libby on my e-reader. So I am very grateful for the technology and the fact that the theaters, the symphony, everybody has created the opportunity to enjoy what they have virtually.
That's excellent. Yeah, and we'll definitely dive into some of the challenges a little bit more. And it's great to hear just the variety of ways that
Oh, yeah.
you're using technology. It's very expansive, and I think that's probably the audience and all of us can relate to just the various aspects of our lives that we're now relying on technology for. So Andrew, I'll turn it over to you, asking a similar question. So how does this data bode for AgeWell kind of at a systems level? What does this mean? What are some of the opportunities that have come up in the last 6 to 8 months?
Okay, Dorina, yeah, for sure. Firstly, I'd like to thank Asan for that presentation. This is an amazing resource of information, and the data is there. And I'm actually interested as a researcher going further into that because it's so wide ranging. There's a lot of stuff that will be very useful for going to our government and really telling them just how important technology is in our lives nowadays, and I think there's kind of an idea that older people are naturally technophobic, and I think this survey has just knocked that on the head, because what we're seeing is that older adults are increasing their use of technology over the last few months in a quite constructive and inventive way. So older people are very much part of the digital world that we live in the 21st century. So that's something that we need to consider. And look at the opportunities that that technology offers us here to support better quality of life, better health amongst older people. It's sorry about that. COVID-19 has been a disruptor, and as Judy mentioned, there's a lot of things where I cannot imagine living under the COVID-19 restrictions without technology, to be honest. It would have been very difficult. The fact that we've got streaming services, I can work at home, etc., etc. This wouldn't have been possible just a few years ago. So technology is now absolutely crucial to the way our lives are, and COVID-19 has highlighted that. There's a few things that have come out of our experiences over the last few months, which I think are very important directions for research and what AgeWell can be doing. Firstly, one of the things that has increased quite a lot is the use of telehealth, for example. So that's been used, because we've not been able to go to our doctors like we used to. I think that is an important trend because it allows us to connect better, potentially. But that is something that has really got to be done properly. There's been a lot of increased use of telehealth, but there's been a lot of dissatisfaction with it as well. And it's got to be done properly if it's going to benefit everybody. So that's clearly an area that we need to work on. Another area that's been highlighted under COVID-19 has been the impact on long-term care. Again, there's one of the interesting things here is that we've known there have been issues about long-term care and residential care for many years. COVID-19 has really highlighted that. So again, how can technology help to provide better services? How can we use technology to connect people together better because of the restrictions? And for older adults who are in the community, we've known that probably about 20% of older adults in the community are socially isolated, generally. And that's probably increased. And the survey has suggested that people are feeling more socially isolated due to COVID-19. So again, technology is really important here. And then in the other areas, we often think about health and well-being, but the very fact that technology is so important for our everyday lives, whether it's watching movies, listening to music, doing our work, these are all important areas for AgeWell to be looking at. There are some issues that need to be dealt with.
Yeah. Let's
sorry,
pause
I'm whittling on here.
Let's
Darina.
pause on the issues. I know we all love to talk about the issues. It's like it's human nature. It's because we want to solve them, and so I think it's great that you and Judy have identified some of those key challenges that we want to be looking at, and even in this environment, even though there is that opportunity that many of us are able to seize in a virtual environment, there are challenges, right? When we talk about rural, remote communities, and that some of that training and connectivity data that Hassan was presenting on. So I see lots of questions about the survey coming in, and thank you, Hassan. I know you've started answering some of them. I think this is a common one that we get, so I'm hoping you can answer it for everyone, which is what does this look like for those over 80, and across jurisdictions, right? Because this is a Canada-wide survey. So folks, a common question is, who did we ask these questions to, and what's, what are their demographics? So if you could cover those
right.
two off.
Right. So in order for us to sample, in order for us to cover every possible opinion, what we did is our sample structure is based on the Canadian population. So it's representative of the Canadian population from an age perspective, from a gender perspective, from a rural urban perspective. So we've captured all of those differing opinions. The other way we did this was a portion of the, about 30% or so of the surveys were conducted over the telephone. So people who may not have access to a computer. And what I did as part of my task was to look at those different demographics split between urban, rural, people who completed the survey over the phone and by other methods. And for the most part, the answers are fairly consistent. And to specifically answer that question about, how the 80+ data looks, again, their attitudes towards aging and the attitudes towards technology are very reflective of, the 65 years of age group. As we would expect, their use of technology or ownership of technology is a little bit lower than those who are 65. But when it comes to how the impact of technology, how they hope technology can help them as they age, all that was very consistent with the data that I have presented today.
Great. And I know from other research in our network that it's looking at, that specifically what results in different uses of technology. It's really, as Andrew was saying, it's not about age. It's often having to do with socioeconomic status, right? And maybe you grew up working a factory job or some kind of, job that didn't require you to use a computer. And so when you retire, you're not using that particular piece of technology, or you don't have the training to use it. And so it's really, I know our researchers will always, reiterate the point that it's really not about age. It's about all the other kind of socioeconomic factors that come into play. So let's get into it. This will be your favorite part. I'm going to ask about the challenges. So I'll go back to Judy. And I know Andrew started with the virtual care piece. And so I know you had some experiences with that. So any challenges that you faced trying to get online with some of these technologies, whether it's virtual care or maybe social media? I'd love to hear your thoughts on that.
With things related to health, we use Apple products. And so my husband has had a few appointments where it was really necessary for him to be seen just on the computer screen. And the OTN, because I have not downloaded Chrome, doesn't do very well with Apple.
And that's
And then when I
the
tried
Ontario Telemedicine Network for our viewers who are maybe not in Ontario.
Yes. So now they have developed an app that had mediocre reviews, but it worked for us. So they have developed an app that he can use. So that's been most helpful. And the other is just really simple things. Again, because I have Apple, I was registering for grocery shopping. They won't accept my Visa with Apple, and the same thing with the Lego store. So I just called customer care and sorted it all out. So as long as it's not too difficult, I can manage it. But otherwise, those are, I think, the most important challenges that we've run into.
Great. I'm glad that whoever that Lego was meant for got it.
Not quite, but it's on its way.
Excellent. Andrew, do you want to speak to some of those systemic challenges and just kind of those digital determinants of health that we often talk about when it comes to access to tech and the infrastructure for tech?
That's a really interesting word that phrase that you've just used there, Dorina, which is digital determinants of health. People from health sciences or a gerontology background talk often about socioeconomic determinants of health, and that, you know, poor people have poorer health outcomes. We can also talk about digital determinants of health as that digitally excluded, and there's a big overlap with, as Dorina mentioned before, with social economic factors, but digital exclusion as well is likely to have a significant impact on health outcomes, social isolation, et cetera, et cetera. So we need to be aware that digital inclusion is now a matter of life and death. It's not something that is, you know, an option, right? And I think governments around the world have really got to get their heads around that. Being connected is just as important as having power. It's just as important as running water. It should be seen as a kind of a utility in the 21st century. You know, and so many people are still excluded for one reason or another. So I do a lot of work in the poorer parts of Vancouver, and just, you know, I'm seeing this all the time. There are other things that we need to deal with as well. You know, I kind of painted a rosy picture before about you know, older people are using technology and technology can help, but there are some huge barriers. You know, like as Judy mentioned, Apple products are known to be, or supposed to be, user-friendly. They're not at all. Most technologies are badly designed still. They're not very usable. They're over-engineered, et cetera, et cetera. And you know, we really need to attend to that. So that's something that AgeWell is doing very much, is that everything that AgeWell does has older adults, caregivers involved in the research project, so that the technologies are designed around them. The other thing as well, if we're talking about digital services, and I'm sure everybody who's listening today has experienced this, is just how terrible digital services are. Just the bureaucracy around accessing things, say information, et cetera, et cetera. We need to do a lot better job on that as well. I don't know if you've used the Service Canada website recently, for example. It's awful. So if people are going to be part of a digital world, these sorts of things need to be dealt with.
Great, thank you, Andrew. So as we move into kind of some Q&A, and I see lots of great questions, I'm wanting to hear kind of you know, what's next for all of you. For, you know, I know, Asan, we've been talking about some jurisdictional looks at the data, and if folks are wanting, to know what's in their particular province. So maybe you can talk a little bit about that, and then I'll move on to Judy and Andrew again.
Sure. Yeah. I mean, we have, as part of the data, we have a lot of different demographic questions. We have urban, suburban, rural, income, gender, age, province. So we can cut the data in a variety of ways. The samples are large enough for us to be able to do that. We have 2,000 people in our sample, so we can definitely do that. I think if there are specific asks for specific cuts of the data, I think if you, reach out to either AgeWell or Darina, and they can get in touch with me. We can definitely work on that and disseminate that to the participants. It's definitely something that can be on the AgeWell website as well. But yes, I know there were a lot of questions about looking at cuts of data in different ways. Short answer is yes, we can look at it in any way that we want. So that's definitely no problem to do.
And know that AgeWell is hoping to do all of those analyses. I think that folks are curious about that have direct implications in terms of their research. So we'll definitely be looking at that. Happy to talk to folks about how we can support your work, especially if you're an AgeWell member with some of this data. Judy, what are the next steps for you? You said your schedule is full of webinars, and so how are you kind of thinking about moving forward the coming months and how to manage the opportunity of the technologies, but also some of the challenges that you faced?
Well, it will be interesting to see over the next few months, because some of the things that we enjoy come in 10-week blocks, and those 10 weeks are almost over. So I think December and the beginning of January is going to be kind of an empty time. I am most fortunate that our eldest has TeamViewer. And so sometimes when I run into a problem, so I'm creating a little list now where we can work together, and he can hook into my computer and help me with some of those things. But otherwise, I guess I'll just try to be like Bonnie Henry and stay calm and keep reading.
I think that's really great advice for all of us. Andrew, what about you? Any kind of remarks or points you wanted to add before we get into some more Q&A here with our audience?
Yeah, I think from a kind of a high level perspective here is about COVID-19 as a disruptor within the kind of the technological world. It's difficult to unpick from the survey what are the kind of the ongoing trends in technology use, because we've seen older adults and caregivers using technology, older adults using technology more as a kind of a general trend. COVID-19 restrictions have kind of impacted on that in a significant way, which we've seen. It's difficult to pick those apart. But I think what we should be looking at is the longer term trends or the longer term impact of COVID-19. And certainly I can imagine us doing this survey again in the future. I think this is an important source of data in Canada and really speaks to some of the things that people are asking in policy. But looking at longer term, are people adopting technology, are going to use it more, or are they going to go back to normal or whatever that normal might be? So keeping a view on those longer term trends, I think is very important for AgeWell.
Great, thank you. This is an interesting question here. I'll start at the top that came in quite a bit early, and one that gets at some of those digital determinants of health, I guess. It's a question about the challenge of accessing really isolated seniors who might be low income, from different backgrounds and really no access to technology, right? So it's how do we bridge that gap? I listened to a TED Talk recently that talked about, it's not just about getting the computer or the tablet or the smartphone to the individual. It's about the infrastructure, the Wi-Fi, the internet access, the cables in the ground, right, that would provide that access, but also the training piece. And I see some questions in the chat about that. So, digital literacy and training. So, there's so many pieces that, just having the tech isn't enough, right? Figuring out how to use the technology, how to use a word processor, how do you use Zoom, the platform we're all on today. So maybe I'll start with Andrew, and then I'd love to hear, Judy, your thoughts on that too.
Yeah, Dorina, you really highlighted something that I, as I mentioned before, I do a lot of work with some of the poorer areas in Vancouver, and that includes some of the poorest, most socially isolated people in Canada. Interestingly, right off the bat, back in March, when the COVID-19 restrictions came about, I was contacted by a community organization who were in panic mode because all their services were delivered face-to-face. And the key thing that people were worried about right at that time was filing their tax returns, right, which they needed help with. And now the community organization closed its doors, wasn't able to do things face-to-face. This was a really big challenge. Now that organization over the last 6 months is now a lead organization in developing digital-based services across British Columbia. So it's gone from no technology to actually being and this is one of the really interesting things about the COVID-19 as a disruptor. It's kickstarted certain things, and I think it's allowed us to respond in these more creative ways. So certainly there is a lot of effort in this area. They're still piecemeal. That's the unfortunate thing, is that so we see local initiatives to get technology into the hands of people who might not otherwise be able to afford it. That needs to be a much more comprehensive thing. It's not just piecemeal and who you happen to be close to or whatever. Yeah. And then again, the simple things like making the technology easier, getting inventive ways of how to get that technology to people who, as you say, who are isolated, requires a slightly different business model to what exists right now. And AgeWell has been developing those kinds of things, and we can provide information to people about those.
Great. And yeah, I'm interested to hear from Judy, amongst the folks that you hang out with, playing bridge or book club, and how are you finding people readily took up technologies like Zoom, or was there a learning curve there amongst you and your peers?
Well, I think it's interesting that some of our friends who have the same kind of technology that we have sort of backed away from everything right now. And I think it's pandemic fatigue. I think they're not sure which way they're headed. But when I was involved with writing nanograms, I was doing some research, and I watched a webinar from Aging 2.0 out of Brighton. And they talked about something called a grant pad. And there is something as well. I just Googled these things. I know very little about them. Claris Companion and Birdsong. And they are simplified forms of a tablet But because at least 2 of them are based on a subscription model, I think that creates some social economic concerns. And it is most handy if you have someone who can help you set it up. But once they're set up, apparently you can research, you can email, you can Zoom, but it's just not quite as complicated as everything else. And I think too, we really as individuals or groups have to start to take some political action. It is possible in some countries to do your income tax online and do it in 15 minutes. It is not possible to do that here.
Mhm.
And what you were talking about before, Andrew, with long-term care, there are so many issues that we have never dealt with in this country that I think we need to start, even as individuals, to try to harness some of this political energy.
Mhm. That's great, and it's a great answer. And I see some of those questions, you know, in our Q&A box here. And Asan, maybe you can speak a little bit about just the sample. You know, how I know we tried to call folks, right? A big portion of the sample is through phone call. And I can say this question's from John, right? Interesting survey. What number of those were surveyed that are Indigenous or poor or homeless, who probably are not included? And I think from an AgeWell side, I can tell you that we are very much interested in doing qualitative research to answer some of those questions in the future, because we know that you know, we're not reaching everyone, those hard to reach. But how do we try and reach those folks from a Environics perspective?
Right. So yes, I mean, the purpose of this survey was to get the perception of what the average Canadian thinks, right? So for that purposes, our sample is representative of the average Canadian population. But absolutely, yes, those hard to reach communities are important communities to listen to. We do have a fair amount of experience working with Indigenous communities, working with homeless communities as well, doing research with them. They're obviously it's a difficult portion of the Canadian population to reach and to sample and to survey. But yes, we are looking at, as you mentioned, Dorina, some qualitative work with them, because we certainly will not be able to get a quantitatively large enough sample to conclusively say that this is what the data for the Indigenous community looks like, or for low-income communities. So for those communities, it becomes very important to directly go and speak to them, more as a conversation than here's a survey, can you fill a survey out for us? So yes, that data will be more qualitative in nature, but the key there is to see how that matches up with what we find in the Canadian population at large. And that's something we have discussed with AgeWell in terms of doing some qualitative research. So yes, they may not be, I'll put it this way, they may be represented in our survey data. However, because they don't make a significant portion of the sample, looking at that data or cutting that data specifically for those communities becomes very difficult, and almost impossible to conclusively say anything. So follow up to that is to go out and speak to them and have a conversation with them more directly than through a survey.
Exactly. Yeah, that's great. There's a thread in the questions we're being asked about general digital literacy. So, you know, where do you think digital literacy efforts for older adults need to focus on? So we talked about virtual care, telehealth, maybe digital banking, and there is that risk there in terms of increased risk of online scams and things like that, targeting seniors who may not be familiar with some of this technology. So maybe Judy, I feel like you I don't know if I can ask you first to start on your thoughts about just, where do we need to focus our training efforts on? And I'll go to Andrew after.
I'm not sure, because I'm not sure in this time how you actually enhance training for anybody if we can't go out and do anything. And I don't want to be look at life through a pessimistic lens, but I don't think we're going to be out doing anything of that nature probably until late next year. So
Yeah.
I think it's very difficult in terms of doing training.
Yeah. Andrew, do you want to add? I mean, there's that fundamental barrier, right, between getting someone set up with the basic digital literacy skills in order for them to access further training on how to use, let's say, a particular software or something like that.
Yeah, it's definitely a chicken and egg situation, is it not? How are you going to get people to use digital technologies if they cannot even use a mouse or get online or whatever? I think, as I mentioned, the community organizations have a big role to play. So we're seeing a lot of support from those community organizations, and they can do things, like the one that I work with here in Vancouver. They'll phone people up, with a technology that people can use, and walk them through doing things, do easy little things like that. There are a number of initiatives that the commercial sector is doing. So, for example, I know that Best Buy has done a lot of work because they see older people as a growing market, and they've put a lot of effort into training their technical support, their Geek Squad, to provide services specifically tailored for older people, and they give training about to their customer representatives how to best support older adults. So I think just across the board, we just need to be aware that some people's skills and abilities are not going to be what up to maybe the average, and that we need to have these kinds of more inventive and constructive ways of trying to include them, and I think that is happening.
Can I add something?
Go ahead, Judy. Yes.
It is possible to go ahead in better times to have training sessions, which is what we did when we first purchased the Apple. Well, I learned how to do so many things that I don't need to know how to do. And I think that's the other thing, to be really able to identify what someone needs and then just focus on that.
That's great. And that's I think that's a great point. I'm going to move into our last couple of slides here on our deck to let you know about our coming events. But yeah, that is how AgeWell does all of our work. We start with what are the actual technology needs of older adults and caregivers, and then developing tech around them. I see a lot of questions still in the chat, and I knew from the beginning we weren't going to get through all of them. So thank you for all of your questions, and we will keep a track of them, and we can kind of stay on a little bit longer if folks are available to answer a couple more. But before we do that, I want to thank all of our panelists for amazing presentations and commentary on this topic, and give you a heads up about some of our events. So we have a Navigating AgeTech webinar series, and this is aimed at both formal and informal care providers or care partners. So you can see the first one is coming up on November 25th, and it will be on Braze mobility, increasing mobility through innovative tech. We have a policy round series, so a bit shorter presentation coming up on November 26th at 1 p.m. with focused on mobilizing international partnerships to inform dementia and missing persons policies, and very similarly related event on an online national forum on alert systems for vulnerable older adults. All of those are in the chat if you haven't seen them already. I also encourage you to fill out our survey, which we do at the end of all of our webinars. It's very quick. I wouldn't even say it's five minutes. It's more like 2. So I see that there are quite a few questions still. So I'm going to, many of them are about the data. So I think I'll put aside, specific data cut questions because I think we've kind of answered quite a lot of those and how we plan to answer them in the future. But there are some questions about, there's a question about, potentially, so asking how do current virtual programs offered to older adults in the community perpetuate stereotypes or ageism related to the use of technology? And I don't know, I feel like Andrew, I don't know if you have an answer to that experience from the community perspective, because that's hard. And I don't know, Judy, if you've had any specific experience of that. It's a tough one because I could see how easily that could happen in terms of having generational differences between people who provide programming and people who are accessing them. But and just in terms of the designing of any kind of training or even technology. So maybe we could talk about how AgeWell tries to prevent, having technologies or programs that are ageist, right?
Yeah. So ageism, like any other ism, is a nasty, pervasive thing within our society that we kind of do unconsciously in many ways. I'm sure everybody is ageist in some way, even about our own attitudes towards our own lives. I don't know. An interesting one that really I came across the other day was the community organization that I've been working with has the word seniors in its title. And somebody was talking to the other day really did not like that word, seniors, for example. So it's a kind of that would be a switch off for a lot of people. They simply would not have anything to do with that organization simply because of its title. So we do have to be aware of how these little things can have a big impact, and the everyday assumptions that we have about older people's attitudes and abilities, for example, shape how we interact with them. I'm getting up there in age terms, and my son's attitudes to me are ageist, and I tell him that, and I'm sure Judy might have some comments to make on that.
Well, I'm probably the most senior one here. The kinds of things that we've participated in, it has nothing to do, I don't think, with ageism. I mean, we do the living and learning and retirement out of Glendon, so everybody is older, and some of them are much more senior than I am, but the quality of the lectures, I mean, they're given by professors, and so no. And it's funny, I mean, I couldn't care less about being called a senior, and I would take a seniors program any day. I used to do dental fit till it was closed. So yeah.
Yeah, it really is it's a personal preference, I think, is what I've learned when talking to older adults across Canada about that. Kind of related, in terms of the design side, there's a question about, do you think it's more important to develop technology platforms specifically for older adults, which is I would say the AgeWell approach and the AgeWell way of including older adults and caregivers from the beginning, or do we need to focus on improving existing platforms to be more inclusive and accessible?
Well, I think they need to do both. I mean, we are the largest section of the population, right? And so anybody, if you're over 60, 61, we're all part of that baby boom. Yeah. And we have a longer life expectancy. So, you know, I'm almost 75. I expect to be kicking around for quite a long time. So things should at least be inclusive, but there's nothing wrong with making things more straightforward, not necessarily simpler, just more straightforward.
Yeah.
Yeah, it's a really interesting question. You know, I think you know, the idea of universal design is important. You know, that maybe our focus on technology development should be thinking about designing things that are inclusive by design right from the start off. You know, that and a lot of things right from the design, from the drawing board, you know, kick things off in going in a particular direction and start to exclude people. So I think we need to be smarter all the way through what we call the innovation pipeline, about right from ideas through to implementation, about how to include people as much as possible. I think that's happening. One of the interesting things that I did notice in the data, for example, is the quite low use of voice assistants. You know, so the idea of voice assistants is seen as a more user-friendly way of interacting with technology. The technology still really needs to develop further before that is really going to work for everybody. But there is an adoption curve. You know, as these become more mainstream, more people are going to use the technology, is going to improve, etc., etc. They will get better. But quite often in these technologies, if there's one tiny little thing isn't working, it completely gets rid of, you know, the whole thing falls down, doesn't it? It's like a house of cards scenario.
Yes.
And you know, so that's a tricky one.
It is.
Judy, it sounds like you have personal experience of that.
Well, I'm not one to read manuals. I expect my machines to work. And
yeah.
When they don't work, that's when I make a phone call. But at the same time, in terms of people being concerned about being called a senior, and it's a silly little anecdote, but I assure you, when I pick up the phone to customer care, and I'm positive I would get the same courtesy. But if I can drop in the words grandmother or grandchildren fairly early in the conversation, it's surprising how positive it is. So.
Yes, I think that's actually a great point for us to end on. Is, you know, it's kind of a positive aging, healthy aging anecdote. Like that.
It is what it is, you know.
Yeah. So I thank you for kind of bringing to life some of the you know, the data and the systemic things that Andrew talked about, and the data that Asan talked about. And thank you, all of you, for joining us, and to the, you know, 20 or so odd people that actually 40 or so odd people that hung on for some extended Q&A. There's still lots of great questions in the chat, and so what we can do is we can try and answer some of those individually if you contact us. And definitely the data questions are top of mind, so look out for kind of future work from AgeWell on that. So thank you again, Asan, Judy, and Andrew, and thank you to all of our participants, and enjoy the rest of your day, everyone.